my name is James. Nice to meet you. I'm a student physical therapist.
Nice to meet you, Christine.
Hi, nice to meet you. So today what we're going to be doing is I'm going to be running a couple of tests through with you just to make sure you're neurologically intact. I am going to put my hands on you on certain tests. So if you do feel discomfort or uncomfortable, just let me know, okay? Alright, so the first test, what we're going to be doing is you're going to be closing your eyes and you're going to close one nostril, okay? And you're going to be telling me what you smell out of the right nostril.
Sure.
Okay, very good. And then close the other nostril.
Cinnamon.
Alright, very good. So that testing was first cranial nerve, olfactory, which deals with the sensation of smell. It travels ipsilaterally, so if, say, a person had a lesion to the right olfactory nerve, she would not be able to smell out of her right nostril. All right, so next what you're going to be doing, you're just going to be closing one eye, okay? And then just look straight ahead. All right, very good, and close the other eye. All right, very good. All right, so that testing was for the optic nerve, cranial nerve 2. What that deals with is the pupillary reflex. So when I shine the light in her eye, her pupil constricted. And if, say, there was a lesion to her right optic nerve, her right pupil will not be able to constrict, since it travels ipsilaterally. All right, so the next one that we're going to do is I'm going to be placing my finger here, and you're going to keep your head still, and you're just going to follow with your eyes, okay? Okay, so that tested cranial nerve 3, 4, and 6, the ocular motor, the trochlear nerve, as well as the abducens nerve. So they all travel ipsilaterally. So say there's a lesion to your right ocular motor nerve. When I place my finger right in the middle, her right eye would not be able to look at my finger. It would actually deviate to the left, or it would actually deviate out laterally. As far as if there's a lesion to the trochlear nerve, when I place my finger out and to the side down, since the trochlear nerve adducts the eye and depression, you would not be able to see my hand at this position if there is a lesion to her right eye, to her right trochlear nerve. And now if I place my finger out to the side and she had a lesion on her right abducens nerve, since it travels ipsilaterally, the eye would not be able to laterally deviate. All right, so next one that we're going to do is you're going to close your eyes and you're just going to tell me where do you feel the sensation, okay? Okay. All right. Awesome. Awesome. All right, very good. All right, so now you can open your eyes. And the second part of this is you're just going to clench down as if you're biting something, okay? And I'm just going to palpate or just feel around. So you clench down. All right, very good. The next one. All right, awesome. So that tested the trigeminal nerve. Trigeminal nerve deals with sensation to the face as well as muscles of mastication. So the first part was when I put the cotton swab and tested her sensation. Say she had a lesion to her right trigeminal nerve, she would not be able to feel sensation on her right side when I did that, as well as she would not be able to bite down and clench and use her muscles of mastication like masseter or temporalis muscle on her right side if there is a lesion. All right, so next one that you're going to do is you're going to just make facial expressions. So you're going to lift your eyebrows up, you're going to smile, All right, good, very good. And you're gonna frown. All right, awesome. So that was a test for your facial nerve, which deals with muscles of expression, facial expressions. Um, Facial nerve travels ipsilaterally. So, say she had a lesion on her right facial nerve, her left would be able to make those facial expressions, but her right side would not be able to. Okay. Next one that you're going to do, we're going to do, you're going to close your eyes, and you're just going to let me know if you hear and where. All right, very good. So that was a test for vestibulotrochlear cranial nerve number 8. They travel ipsilaterally, so if she had a lesion to her right vestibulocochlear nerve, she would not be able to hear the sound out of her right ear. All right, so next one, you're going to stick your tongue out and say ah, okay? Oh, and just hold on 1 second. Do it one more time. All right, very good. So that was testing for her glossopharyngeal as well as her vagus nerve. With that, I should be able to see her soft palate elevating. If she did have a lesion to her left glossopharyngeal nerve or her left vagus nerve, her right side would be able to elevate, but her left side would not be able to. You would see no movement towards that. So next test, what we're going to do is you're just going to lift your shoulders up, and you're going just to resist me, okay? Lift up. All right, don't let me push you down. All right, very good. So that testing was for her spinal accessory nerve, cranial number 11. So a spinal accessory nerve innervates her trapezius muscles, doing the shoulder elevation. If she had a lesion to her right spinal accessory nerve, since it travels ipsilaterally, her left side would be able to lift up, but her lesion side on the right side would not be able to lift up, or it would not be able to take my manual muscle test. It would just go right down. It would not be able to resist. All right, and then next one, what we're going to do is, so you're just going to stick your tongue out this time. All right, that's it. Very good. So that was cranial nerve 12, her hypoglossal nerve. That deals with muscles of the tongue. If she had a lesion to her right side, her right hypoglossal nerve, you would see the deviation towards that right side. Okay. All right. Very good. Thank you. You did an awesome job.